Good afternoon, everyone. Welcome to the August Superintendent Webcast. We had a month break over summer to kind of let you catch your breath and get ready for this coming year. We're excited to restart these webcasts. We've got a busy agenda for you up ahead. I did want to start just by mentioning that we continue to hold in our thoughts the Eastern Kentucky communities and school districts that are impacted by the recent flooding. We will hold a superintendent huddle on Thursday to talk more with those superintendents. We had the first one of those last week, and we're able to connect them with some of the superintendents from the Western Kentucky school districts that were impacted by the tornadoes. And we heard just some level of the devastation that's has taken place in Eastern Kentucky, really with a lot of districts just starting to unpack what the extent of that was, what mitigation might look like, what school reopening might look like, and the extent of that in their communities. Still lots to figure out. I think that we'll learn more after our huddle conversation on Thursday, even more about what supports are in place and what the longer range implications look like. So we continue to work to support them. And I also know that several of you are either already started back to school or starting this week or starting in the next couple of weeks. So this is sort of that time of year when things get going again. We hope that you and your communities are doing well in that. This is potentially the first undisrupted year of learning that we've had since the 2019-20 school year. So we're looking forward to that, hoping for the best when it comes to making up for some of that disruption that we experienced. Of course, you'll hear a little bit later that we're not entirely finished with COVID, or COVID's not entirely finished with us. But we think it's in a certainly more manageable place than it has been in the past. And we continue to appreciate the partnership that we have from the Kentucky Department of Public Health, Dr. White and Dr. Stack, on supporting us with that. Our agenda for today is on the screen. We've got Dr. White on to cover COVID updates and any other public health updates that we have. We're going to talk a little bit about United We Learn and some ideas that we may have for that and supports for that you may be able to use in your community. We have Dr. Young on with us from the Kentucky Board of Education to provide an update on what the KBE has been up to and some of the things that they're working on and thinking about. Kelly Foster is on to talk about continuous improvement, a number of different activities that she and her team have going on. We've got Dr. Woods Tucker and Mickey Ray, our Chief Academic Officer, on to talk about our diversity, equity, inclusion, and belonging team updates, and then we'll finish with question and answer. So that's what our agenda looks like today. We'll start things off by bringing on Dr. White. Dr. White, are you on and available?
I am here. Yes,
Excellent.
Dr. Glass. Thank you so much.
Thank you, Dr. White. Tell us what's happening in the world of public health. You continue to be busy, and we're not sure COVID is finished with us, but where are things right now?
Well, thank you for having me. I'm very grateful to be warm and dry, vaccinated and boosted. That's where I am right now. I want to share with you just some of the numbers that if you don't go to the kycovid19.ky.gov website, you've seen this slide 1,000 times before, but we are down here now. So we have our first winter surge, we have Delta, we have Omicron, and now we have where we are now. Just to be aware, these numbers that you see here are not even close to the right numbers because this does not include any of the home testing people are doing. So as you see these numbers kind of plateau off right now, we are not seeing everything that's happening in the state, but that does give us an overall flavor of what's going on in our state. We were down the end of April, and we are, even with the testing that we're doing, we're starting to see increased number of cases. We are not seeing the hospitalizations, the ICU admission. Oh, I'm sorry, I'm a slide ahead of myself. Let me do this one next. This is the COVID-19 community level indicator that the CDC put together. Just as a reminder, these are taking the rates that map we used to show all the time, which was just strictly the numbers. This is taking the rates of cases in your county plus the new hospitalizations in the catchment area of your county, plus the ICU admissions for COVID. And they put that together and they give something called a community level indicator, which is much more accurate than just looking strictly at numbers. So you can see where you are. I can see where I am. I'm in a red county, which is why I have my mask Webcast right here at my desk as I move around in the building. But that is updated every Thursday night, and it's on our website. You can see that Friday morning if you want to use that as to help you as an indicator of what's happening in your community, and that is posted on the website. This is this is the slide I jumped ahead of myself on. This is looking at starting in July of 2020, where we can see the blue line are patients in the hospital because of COVID. The orange line is the number of patients in the ICU because of COVID, and the gray line are the number of patients on a ventilator because of COVID. So we are, even though we have up to now a little between 600 and 700 people in the hospital because of COVID, we are not dealing with the ICU and the ventilator cases that we have had in the past, which we are very grateful for that. This is a slide that looks a bit busy, but I think once you get the general gist of it, it's one of those aha moments if you're a little bit nerdy and like numbers. So this first column over here takes the number of cases we have had in Kentucky, and we break it down by the gray box are the number of unvaccinated people that have been infected. The blue box are the number of people who have had the primary series that have had a case, and the light blue box is the number of people who have had a case that have been boosted. Same kind of breakdown with the deaths, very similar percentages. The percentage of unvaccinated people that have died, the percentage of people that got the primary series that have died, and the percentage of people who were boosted and have died. The thing that's interesting is contrast these first two columns to this column. This is a breakdown of the Kentucky population. So a little less than 40% of the population of Kentucky is unvaccinated, yet they make up 62.2% of the deaths and 61.5% of our total number of cases. 25.6% of the Kentucky population have received the primary series and gotten at least one booster dose, but that 25.6% of the population make up right about 10% of the cases and a little over 9% of the deaths. So I think it's a really interesting way for people who say, well, I got the primary series, do I need to get boosted? I think these light blue boxes really show you why that is so critical and important. So we did come out last week, and it was in the Monday message yesterday. It's posted on the COVID website. Our August the 1st, the date is right here. The guidance, where we took last year's guidance document and tried to make that a little better for your use this fall. So you'll go through there. You'll find that quarantine is something we've gone ahead and taken out. Just if you've been exposed, you should wear a mask. And if you're sick, please stay home. Doesn't matter what you're sick from, but we certainly want people that are sick with sniffles and colds and coughs and fevers to stay home and not infect each other with anything. Remember, flu season is coming up very soon. The other thing that's not listed there in detail is the Test to Stay program. The next slide will explain to you a little bit more why that is. There will be testing again this fall in a very different context, but there will be testing this fall, and you can use those free tests in whatever way you want to use them. This was also in the Monday message, and this is our fact sheet about the 22-23 school year. As many of you participated in last year, we do know that there were lots of schools that contracted with laboratories who came in and did testing for you, and the CDC had funding for us to pay those contractors for that work. What CDC has decided to do this school year is they are owners of a large cache of antigen tests, point of contact tests, as well as home testing. Those two different kinds of tests will be made available to the districts so that the district can determine how many tests they want to order. They can order them from us. We have them in our warehouse, and we will UPS them to you It's usually about a 2 to 3 day turnaround. So it was in the Monday message yesterday, but here are the links to where you as a district can determine how many point of contact or antigen tests do we want to use in our school system. If you do that in your school system, you will need to be a CLIA certified lab or part of a CLIA certified lab. So you may partner with your hospital or with your health department or a large multi-specialty group in your community to be able to allow someone on your staff to do that antigen COVID tested there in the school with the proper permission and all of those the criteria that your system requires. If you do not have that, then you can order the take-home testing. So if little Jason gets sick and the school nurse says calls his caregiver to come pick him up, then you can provide little Jason with a couple of home tests that the parent can take home and do a test on that child. We also at this time are, and it says up here in this little box right here, so the student, children in the school, so siblings, employees, volunteers. If you've got a pre-K and a preschool that's attached to the school, they can use these free tests, and then other household members. These are the same criteria. We've tried to keep as many things the same as last year, so this is not a whole new learning curve. I will tell you, I do not have documentation for this, but we found out at the 11th hour yesterday, they're going to also allow these for early childhood centers. I know that doesn't have anything to do with you, but if you get that question, we are going to have to figure out a way, how do we get these to early childhood centers not connected with your schools? So that's just some information for you in your back pocket. So this flyer was in the Monday message yesterday, and you've got you can scan this QR code. You can go to the links on here. We've got information here on how to do the testing. We've got information here on how, if you want to become a CLIA laboratory, if you do the testing in your school, then you will need to report those to the Department for Public Health. We've got a link on how to do that. So we've tried to put everything on this one piece of paper that can guide you. And of course, if you have any questions, you're always welcome to ask. This second handout that I'm showing you is something we put together if you want to give that to caregivers. If you want parents or you want caregivers to know, this is how our school COVID test is going to be this school year. This is something that you can use to hand out to them if you wish to do that. If you do decide to do testing in your school system. So we tried to think of things that we thought might be helpful. We know with school starting, you've got 8,000 jillion things to do. So we wanted to try to put these things together for you to make it a bit easier for you. So I will go back to the screen and I will be available for questions. And I know there have been some in the chat box that Tony already has. So that's a real 30,000, 100,000 feet view. I know y'all know how to find this information down now on kycovid.ky.gov, but I wanted to give you an overall starting point. As far as the tests go, you can order your tests, and then if you want to order some more, we will get monthly orders from you as you decide you use the test you've got or you see you're going through them. You can order some more. We have a promise from the CDC. These will be available through the end of January. Will it go on past that? I am hopeful, and I think that they're just kind of under promise and over produce, but that is in writing where we know we're going to have tests until then, and then as we find out that they're going to extend that, we will let you know. Thank you.
Thank you, Dr. White. A couple of questions that we could cover with you now. The first one I'll just add, we've heard that COVID-19 is in an endemic phase now. Tell us what that means and what the long-range implications of that are.
Well, part of being endemic is it's kind of like the analogy is the flu. We have flu. We know we're going to have flu seasons. We know that we're going to recommend flu vaccines every year. And so as this becomes a more common illness, and thank goodness, a less, oh, sorry. My husband wants to know what I want for dinner tonight. Um, as this is less dangerous as far as hospitalizations, ICUs, ventilator. Hopefully, as vaccines get more sophisticated, this will be something we will anticipate being around all the time. That's why we have moved from quarantine, as far as people going home, to if you've been exposed, be careful, protect your peers. If you're sick, stay home regardless of what you have. So it is going to be something. The long COVID, we don't know until we've been long. It's hard to tell you what's going to happen 20 years from now when it's been around for 2 years. But that's going to be continued to be monitored, and that's always a concern for me when someone is COVID positive.
Thank you. A question that we had come in from some of our districts, when can we expect any revised guidance from CDC, or should we expect any?
Well, it seems like they wait until Kentucky sends their guidance out. We put off as long as we could, and we thought August the 1st was the longest we could expect the schools to wait for some type of guidance. Last time we did this, they came out with guidance within a few days. It has been now over a week. All the calls that we're on, they keep saying guidance is coming, but they do not give us a date. So that's why we went ahead and put the guidance out we have. From the guidance that we have, though, is gleaned from the conversations that we have on a regular basis with our CDC partners. So we do not expect anything there to be any major, sudden, oh my gosh, kind of, we didn't think of that issues. We think we've got it covered pretty well in the document we've produced.
Great. And then unrelated to COVID, we have another rising public health concern with monkeypox, which is a different disease than COVID. It's transmitted differently. It's just a different disease that we're dealing with. But do we know anything about if the CDC will be issuing guidance around monkeypox? Is that forthcoming? Do we know anything about that can be shared?
Well, right now, not that we're aware of, because there has not been a huge number or even a moderate number of children that have turned up to having monkeypox that we are aware of that are in the reports. So if we have an increase in those numbers, then yes, we would anticipate the need for some guidance. But right now, there's no talk about that.
Okay, and then a question related to that came in is the CDC right now only has monkeypox listed by state. This may relate to the last answer that you gave, but do we anticipate it being available by different county or community, or is it maybe the incidents are so low that that's not necessary right now?
Well, you're absolutely right. The incidences are low, so we are very careful at the Department of Public Health of the numbers have to be higher than 5 before we release anything in a county. But we have released numbers to reporters of where the Kentucky cases are right now. They are still very low, less than 15 in the whole state. But we figure those numbers may very likely be higher. We just need to be more diligent with our testing, and we have several times a week calls with health departments to be sure that we are connecting with our partners who are able to connect us to the right folks that need to be tested that meet the criteria. So we're working very hard to test as many people as we can so we don't have any unknown cases.
Great. And we've all become sort of Facebook experts on COVID over the course of this pandemic, but monkeypox is, again, something different. So do we know anything about vaccines that are available for monkeypox, and will those vaccines be available for healthcare workers? Will that be necessary? Will school nurses be included in that? What do we know about vaccinations and monkeypox?
Well, the vaccination that we use is the vaccination we also use for smallpox. So there are stockpiles of vaccinations. The newer one, though, the Genos, is the one that we are recommending. we certainly don't want. We're cognizant of people's other healthcare issues, and feel the Genos is the better one, because we, at the time that they started passing out the vaccine, only had 5, 6 cases. This has been several weeks ago. We got a very, very small amount. We got another influx of vaccinations the last week of July. We were kind of busy, as you were, the last week of July in Eastern Kentucky. So we're trying to get that vaccine out. We are not giving it to every single health department, because what you don't want is, you don't want 5 doses in every county in the state not being used. So we're trying to strategically place them in the locations where we think there's the biggest need. We will get another influx of vaccine by the middle of this month. So we're pushing that out. And just an hour ago, I was on a call with Dr. Stack saying, yes, we want to vaccinate as many people as possible, but we want to be sure we have some on hand for healthcare workers. Now, since we don't have cases in our school systems, then school nurses would not be the first group we would vaccinate. We would want to vaccinate those folks that are actually in contact with folks that are monkeypox positive. But we're very cognizant of being sure that we do have enough. If it were to become something that we were seeing in school systems, then yes, our school nurses would be a group that we would be very interested in taking care of.
So I'm hearing that monkeypox is something of concern. It is spreading. Vaccines are available, although there's it's still being determined how widespread that needs to be. The smallpox vaccination is what you use to vaccinate against this. We're still monitoring and observing to see how it spreads around the country and within communities, and still sort of much more to be learned. And I'll skate out on thin ice and reveal what I know about it. It is a skin-to-skin contact transmission, right? So it's a fundamentally different transmission vector than COVID.
Absolutely. And it's a prolonged skin-to-skin contact. So it's not a fist bump, it's a prolonged skin-to-skin contact. And so it's not the kind of transmission you would expect to see in a school system. So it would be very unlikely for that to happen. Now, I didn't say never, but it would be one of the lower places, the least likely, that's a better word, places that you would have that type of transmission. But because I forgot it, even though I wrote it down, it is very important that you still have an isolation room in your school, whether you have it for someone who you think has monkeypox, or someone you think has COVID, or someone you think has flu. I was honored to speak at the Kentucky School Nurse Association meeting last month, and we did talk about that. So I'm sure you're going to be hearing from your school nurses. We still do need that isolation room as we're going through COVID into whatever happens to come through next. So they asked for me to be sure and remind everybody of that's still a concern, that we need to have that for student and for staff safety.
Thank you, Dr. White. I don't see any more questions that have come in, but we are delighted that you're with us, and we'll be sure to have you on when the next threat to human civilization comes up. We'll have you on again. Thank you, and we'll turn things over to Tony Tatman now.
I'm your woman. Give me a call, Dr. Glass. Thank you.
All right. Thank you, Dr. Glass. Just a couple of communications updates for everyone. First, want to start off with some great news about our Teacher of the Year competition. So since we last met, we have named both our 24 initial winners for the Valvoline Teacher Award winners. And then we have also named our 11 semifinalists for Kentucky Teacher of the Year. You see the names listed on the slide there. We have 3 from Jefferson County, 1 from Hopkins County, 1 from Henderson County, Newport Independent, Clinton County, Crittenden County, Kentucky School for the Deaf, Knott County, Fort Thomas Independent. So congratulations to each of those districts. We're working on finalizing the scores for these teachers, and are looking forward to our first in-person Teacher of the Year ceremony at the Capitol in the Rotunda on September 20th. And more information will be coming for that to your teachers and to districts that have had a awards recipient this year. Excuse Excuse me. As Commissioner Glass mentioned, we will have our second superintendent's huddle on flood recovery. It'll be on Thursday. You should have a calendar invite in your email. If you do not, you can send me an email. We'll make sure that we get that for you. It will be at 1:30 on Thursday. Also want to recognize the fact that we have about 2,400 key educational technology staff who are going to be or have been awarded the 2020 to 2022 Stillwell Award. You're going to be receiving these, their coins, commemorative coins here in the next, probably throughout the next 4 to 6 weeks or so. They're going to be delivered to schools from staff, and we'd love to see pictures of those as they get delivered and shared with us. This year's two-year time frame recognizes the unique circumstances that ed technology staff played during supporting our schools during the COVID-19 pandemic and continue to play. So we just wanted to this is just a token of appreciation for our key education technology staff across the state, and we look forward to seeing the pictures when you get the coins. Also wanted to mention that we have launched a toolkit to help our educators support LGBTQI+ youth. The link to that resource, which is on our website, is linked in the PowerPoint in this PowerPoint presentation. And it has research and data and relevant pieces of non-regulatory guidance from the U.S. Department of Education, as well as links to other national organizations that provide resources to educators in the classroom. I also wanted to take a moment to remind all of our districts that this is a great opportunity at the beginning of a school year to remind folks to stop for school buses. As we all know, drivers can receive a fine, but for a child, it could be a matter of life or death. We have partnered at the Department of Education with our friends at the Kentucky Transportation Cabinet to help remind drivers of our laws when it comes to Kentucky school bus safety. To learn more and to download a printable poster and graphics, you can use this link, but also go to our transportation page on the website and also to the Kentucky Transportation Cabinets page. Also, last week, we launched the United We Learn Toolkit for Superintendents. You should have seen it in the Monday message a week ago, Monday, and then we also are going to include it in the next couple of weeks in the top right corner of the Monday message. There's a button that says Toolkit. It will take you to a Google folder that has a whole bunch of resources for you as we talk to you about our vision on United We Learn. It was created to help you in each of your districts to communicate with your stakeholders about the United We Learn vision. As you remember, the vision was created by Kentuckians across the state. We spent a great deal of time as we were gathering feedback from stakeholders all over the state during our listening tours and different sessions of feedback, and created the 3 big ideas that Dr. Glass will talk about here in just a little bit. And everything in this toolkit is really just kind of a grab and go. It's just meant for you to take it and use it as a resource. As part of that, we do have a video. It's a video that we've crafted to show you, to explain a little bit more about the initiative, and I'm going to share that with you now.
Hi, I'm Jason Glass, Kentucky's Commissioner of Education and Chief Learner. Welcome to the new school year. I hope you've been able to rest and recharge over the summer break and are as excited as I am to welcome back students to our schools. We have a lot of work ahead of us this year, and I'd like to spend a few minutes sharing an update on United We Learn, our new vision for the future of education in Kentucky. Since coming to my position nearly 2 years ago, I've seen the tremendous work so many of you are doing to move public education in the Commonwealth forward in a positive direction. The Kentucky Board of Education is making strides to define a statewide portrait of a graduate, and that builds on the abundance of examples we have of connected and long-standing efforts already underway to bring about meaningful changes to learning here in Kentucky. But now we may be at a critical tipping point when it comes to this change. It's taken us years to get to this moment, but if we can connect and support the work happening across Kentucky, then I believe we can bring about a real and lasting change for our schools and our students, and that is where United We Learn comes in.
The ideas for United We Learn didn't start with me or the Kentucky Board of Education or here at KDE. They originated with more than 1,000 connections and conversations with Kentuckians all across the state over the past 2 years. Our work was built from the ground up by hearing from students, teachers, families, administrators, and community members to determine what needed to change. Kentucky has told us we needed 3 big and important educational changes. The first of those is that we need to create more vibrant experience for every student, giving our students the kinds of deep learning experiences that spark curiosity, motivation, and engagement. Those experiences that will truly prepare our students for the fast-moving world that they will inherit. Second, Kentuckians told us they wanted greater innovation in our schools, especially when it comes to assessment and accountability, and that our historical systems of testings and school rankings can also act as barriers to the kinds of deep learning shifts that we want to bring about for our students. And finally, Kentuckians told us that we needed to work on finding genuine ways to collaborate with people all across our local communities, especially people in groups who haven't always been at the table when education policy decisions have been made. Every one of our families has a unique story, and each child has individual talents that they contribute, and those have to be valued and understood. And our students and families come to us with different levels of support and experiences, and we have to take steps as an education system to meet our students and families wherever they are and give them the support that they need to succeed. We're still in the early stages of sharing our United We Learn vision, but that doesn't mean that the work to bring these 3 themes to life hasn't already started. In fact, I know that most of our districts have already done the work of defining their own portrait of a graduate and have elements of this effort well underway in schools across the Commonwealth. There are many, many bright spots across Kentucky, and we'd like to hold these examples up, share their stories, and connect them across Kentucky. We want to make sure we support the incredible work happening related to the United We Learn. Kentucky has long been known for taking big, bold steps in education, and I know that we can again lead the nation in bringing about meaningful change for our schools and for our students. I am so proud to be a Kentuckian and to support this exciting and important work with all of you. Thanks for all you do to support your students, staff, and your community. Let's work to bring about the transformation and learning that our kids need and deserve. Have a great 2022-23 school year, and thank you.
Great. So thank you for taking just a few minutes to listen to that video. That is one of the examples of things that are in your toolkit that you can use and happily use in your websites or your social media as well. And I will kick it off or send it over to Dr. Glass, and he's going to lead you in the next activity.
Yeah, thanks, Tony. So we launched the Superintendent Tool Kit really with the thinking that some of you may be wanting to engage your own communities around United We Learn, to give you some tools and resources that you could look at, modify them for your context, and then make your community aware and find ways to engage within districts and schools around Kentucky on changing the student experience, on bringing innovation to education, and on involving and connecting with your communities in novel and meaningful ways. So we thought we could try to share some of those ideas today. One of the central concepts when it comes to changing the student experience is this notion of student task, or what's the work that we give students to do. So we've talked about the 3 big ideas that are within United We Learn. Tony shared around a Google Doc that has some space for you to record some of the things that are happening in your community with this first big idea around changing the student experience. So the question that's there, really the task for you, is imagine that you're presenting representing at your back to school event with families, what examples could you give of what bringing vibrant student experiences are to help parents understand what those look like in your community? So think about some meaningful student experiences that you're creating or your teachers are creating in your community, and what might those be? So we'll give you a couple of minutes to populate that Google Doc that Tony sent out to you, and then we'll just check in on a couple of those ideas. We hope that you can see some concepts and themes from other districts, and maybe give you some ideas on some things you can talk about in your community about how you're bringing those meaningful learning experiences to life. So we'll take about 2 minutes and do this.
Dr. Class, would you like me to share the Google Sheet? We have a couple people that are filling that out. How did you want me
That's
to work
great.
that?
Yeah, go ahead and do
Okay,
that,
I'll
Tony.
do that.
Thank you.
Okay.
So we'll take about 1 more minute, and then we'll just read off a few of these. Okay, great. Looks like several of you have put information in there. We'll just read a few of these that have come in, but please refer back to this Google Doc just for some ideas on things that are happening in your community. So we heard from Sherry Satterley at Frankfort Independent about their Second Street School revitalizing grounds and cafeterias through a farm to school grant. And at Frankfort High School, all the students are matched with an internship for half of their day. It's meaningful to their post-secondary school. So great examples coming in from Frankfort. Chuck in Spencer County said students participate in Genius Hour activities. They choose subjects that they're interested in and do research on them. They prepare presentations for those. Great example of that full, well-rounded project-based learning structure. Sally Sugg from Shelby County said students in their CTE programs have begun their own home-based businesses with demonstrating a variety of the skills they learn. Casey Janes from Carroll County said students are able to attend a variety of programs within the district through their iLead Academy. JCTC at Carroll County campus, the ATC, and the ATC are beginning to start various co-op, mentorship, and intern opportunities with local community businesses. You've got tons of other examples coming in from Eulenburg County, from Jessamine County, from Russell Independent, from Casey County, from Caverna, from Callaway County, and Danville Independent. So I see those coming in right now. Thanks to all of you that are putting that information into the Google Doc. Again, I hope it'll be a resource for you, because I'm sure that some of the things you're seeing your colleagues put forth as some of these ideas are also things that you have going on in your community. We know that just the example of deeper learning activities that were put here are just scratching the surface of all of that work that's happening in your communities. One of the things that I've repeatedly tried to stress here in Kentucky is that there is just years of capacity that's in place. This work has been going on for a number of years going back, and we really have reached this tipping point where I think it's just ready to explode with life and flourish in the state. So great examples there. Tony, I'll turn things back to you to close out the communications updates, and then I think we've got Dr. Lou Young on to talk about the state board and the work that they're doing.
We do. Just wanted to say thank you to our superintendents for participating in that exercise for us. It's really helpful for us as we work to kind of tell the stories of each district and such. So just thank you very much, and continue to fill those out. And if you have any questions, just let me know. And I will, I think, kick it off to Dr. Young. Yes, she is next on my list. So there you go, Dr. Young. I will take it if you want to take it on over.
Excellent. Thank you so much, Tony. And thanks, superintendents, for showing us the great work that's happening where your students are applying their knowledge, skills, and dispositions to unique settings. That's what deeper learning is all about. So it's a delight to see that. Happy New Year. I know several of you started last week and will be continuing into school start this week and next. And I know it's an exciting time. Keep in mind that our prayers and thoughts are with all of those of you who are still dealing with the aftermath of tragic flooding in East Kentucky, and just know that we stand ready to support you. Dr. Glass and the team have proven that they're there for you, and so I look forward to any kind of support that we might be able to provide. Next slide, please. We were able to welcome our 2 new state board members at our meeting in August. Joanna Stevens from Garrett County, a teacher at Garrett County High School, and Jude Dela, a student in Boone County Schools, are our new teacher representative and student representative ex officio members of the State Board of Education. Joanna and Jude jumped right into our August meetings and were important contributors out of the gate. And we're so excited to have them. Thank you to the superintendents in Garrett and Boone for the gift of their time and engagement on the state board. We look forward to learning from them even more as this year unfolds. On that note, next slide, please. I will give you a quick update about our 2 meetings in August. We held back-to-back meetings, a work session, followed by our regular August meeting in the first week in August down at Lake Cumberland at the state park there. The work session was an exciting time of professional learning and engagement on the part of all of our state board members, under the direction mostly of Dr. Glass, who took us through some visioning work around United We Learned, where we had a chance to get up close and personal with those 3 big ideas around vibrant learning experiences for every learner, innovation, and deep community engagement across Kentucky. So we spent time working on that, as well as hearing from Dr. Foster and her team about school improvement practices post the hiatus we've had of the last couple of years during COVID. We heard from a cross-agency team who shared with us about how to better meet the needs of the whole child in virtual learning environments as we considered new regulations there. And then lastly, we looked at the potential goals that we would have for this upcoming legislative session in January of 2023. That was on the first afternoon. The second day, next slide please, was our regular meeting. At that point, we did elect chair and vice chair. I am delighted to be serving 1 more year as the KBE chair, and Dr. Sharon Robinson is going to continue 1 more year as vice chair. We are term limited at that point, and we'll be looking for new leadership over the course of this year to step in for us. But it is a delight for me. It is a professional highlight of my career to be serving in this role. So I'm appreciative of that opportunity. In our regulatory work, we also approved policies for the School for the Blind, the School for the Deaf, and the Kentucky Tech System. We heard from our agency leads in those areas and look forward to further engaging with those schools for whom we serve as their Board of Education. We also approved 704 KAR, if you'll go back 1 slide. Yeah, thank you. The 3:535, which is around full-time enrolled online virtual and remote learning programs. Many thanks to LSAC for the review. A special thanks to Associate Commissioner Couch, Chief Digital Officer Marty Park, and their team as they laid out the expectations of making this regulation from emergency reg through COVID to permanent regulation moving forward. And we really appreciated the sensitivity that the agency showed to our concerns as state board members to ensure the highest quality learning environment for every learner, even in full-time enrolled online virtual and remote programs. Commensurate with that regulation change, we also approved changes to 702 KAR 7:125 related to pupil attendance in those settings. And the news release from the state board meeting is available to you in the link to today's slide deck if you want more details. Please don't hesitate to reach out if you have questions about that. On that day too, we were also able to recognize the 2022 Grissom Award for Innovation in Special Education. We had 2 winners in this category. The first, Barbara Washington, a recently retired professor at Murray State University who has devoted her career to support for students with disabilities. And out of Madison County, Alexis Patterson and Janine Mosher, for the Person First Academy that they run there in Madison County. More information about that award item can also be found at the bit.ly that's included in today's slide deck. And then I think I have one more to close. On the second day, we were able to kind of conclude our morning with hearing from in person the 2022 Kentucky Teacher of the Year, Willie Edward Taylor Carver Jr., shared with us his reflections about his time as the Kentucky Teacher of the Year. He has been one of the most prolific, most highly engaged, most nationally recognized Kentucky Teachers of the Year in recent history. There is a video linked here that you might be interested in seeing, and we really appreciated Willie's heart for the work of teachers and the work of Kentucky students, especially those that he served in Montgomery County and the foothills of Appalachia. So it was lovely to get a chance to hear from Willie and to thank him for his service as the 22 Teacher of the Year. I believe that's, let me check the next slide just to make sure I didn't miss one. Oh yes, coming up, what's next? We meet again in October. We have moved to a 2-day format, not 2 full days. We have found that it's more refreshing and more engaging and energizing for board members if we meet the afternoon of one day and the morning of the next to still accomplish the amount of work that needs to be done, but without the level of exhaustion that began to seep in some of our meetings over the course of this past year. And we are delighted to be out in the field again for our October series at the Logan County Career and Technical Center there in Russellville. So we look forward to being at one of our ATCs, conducting our meeting there in October. We'd be happy to answer any questions that you might have. I believe Tony has provided a doc for that. Thank you so much for your time, and again, happy new school year.
All right, now we've got Kelly Foster on to talk about several updates from her team. Kelly, are you on with us?
I am. Good afternoon.
All right, go right
glad to
ahead.
see everybody. Okay, the first thing I want to talk to you about is the National ESEA Distinguished Schools Program. And these schools are recognized every year at the winter conference in February. I believe next year it's Indianapolis. So I would like to encourage you all to apply. The deadline is September the 2nd. And you can see there on the slide, there are 3 different categories. Category 1 is having exceptional student performance and academic growth for 2 or more consecutive years. Category 2 is closing the achievement gap between student groups for 2 or more years. And then category 3 is excelling in serving special populations. So look at those categories, and we would love to have some of your schools apply for this. Next slide, please. To kind of tie into what Dr. White was talking about earlier, if you'll remember, you have a safe return to in-person instruction and continuity plan. And so you may call that your Senate Bill 1 plan, you may call that your ARP-ESSER plan, or your COVID-19 plan. And as part of the ARP-ESSER program, you must update this plan every 6 months. So this is just a friendly reminder. If you haven't updated that in the last 6 months, you need to revisit that. That plan is supposed to be posted on your website. And then also on the KDE website, we still have the yellow banner at the top, and that's where you have to submit those plans. US Ed has asked for those. Through the monitoring process. So just make sure that your plan is up to date, post it on your website, and if you make any changes, please repost that in the yellow band on the front of our webpage. And the last information that I'd like to share with you guys today is the upcoming Continuous Improvement Summit. This will be our 9th year of having the summit. We did not get to have that in fall of 2020, but the registration is open. There is a link in the slide, and it's also been in our Monday message for the last couple Mondays. It'll be held September 26th and 27th at the Central Bank Center, which is formerly known as the Lexington Convention Center, right there next to Rupp Arena. So if you are not registered to attend the summit yet, please do so. We are hoping to have close to 1,000 participants this year and really looking forward to seeing everyone. And that's all that I have. Thank you.
All right, thank you, Kelly. And next up, we got Mickey Ray from the Office of Teaching and Learning, covering some early literacy assessments. And I think we had some information on diversity, equity, inclusion, and belonging as well.
You're correct,
Not sure.
Dr. Ross.
Yeah, I'm not sure who's going first. I'm not sure. I know Dr. Woodsucker does not have a slide, so we can let him go first, maybe? We'll do that. All right.
Yeah, we're going to save the good stuff in the Office of Teaching and Learning for Mickey, especially being an English teacher and a reading teacher. She's going to give a fantastic update regarding our literacy resources. So we'll save that for Mickey in the Office of Teaching and Learning. Now, let me quickly give you an update on some of the going-ons with in the Office of Teaching and Learning, our diversity, equity, inclusion, and belonging equity playbook. My first comments are sort of like similar to what Dr. Glass and Dr. White shared, but I want to make sure that I properly recognize, not only personally, but also on behalf of the agency, as our colleagues embark upon a new academic year, we recognize that this year, like the last few years, is very unique. As we're learning more about the tragic events in Eastern Kentucky and the impact that the flooding has had on our family, students, and schools, please know that it's a heavy heart that we have. But again, we're here to support you, as Chair Lou Young said. We also recognize, as Dr. White said, that many counties are also experiencing an increase in COVID, although the overall numbers are going down. And we know that will wreak havoc on staffing and will present challenges for some of our students. And so we want to make sure we keep that in mind. And for these reasons and others, we believe it's necessary that we always look back and provide flexibility on our work, especially as it relates to our equity playbook. A couple things that I want to remind you of, and you'll certainly have closer contact with our DEIB coordinators in our 8 regions plus at KDE. First, each school district that's involved, each school that's involved will receive personalized coaching on competencies related to equity. And keep in mind, our teachers will not be pulled away from their schools. The professional development will be delivered in person a couple days, or it will be done online. So again, we're not going to take your teachers out of your schools. Secondly, we want to identify and develop a problem of practice related to one of our 5 equity pillars, whether student achievement, discipline, coaching, climate, instruction, or utilization of resources. And then again, on instruction, looking at high quality instructional resources that we've been talking about for the last 2 years. Again, I can't think of any school district in America that's not confronted with one of those 2 or 3 or 4 challenges that we just talked about. So really it's work that's outlined in your strategic plans. And we want to give you the coaching resources. And we know when coaching is done correctly, when it's implemented correctly, it helps to increase teacher efficacy as well in their instruction, and it raises student achievement. The big thing here, the big change here with all these other factors that I mentioned, there are 3 entry points into working with the playbook. As I said, about a year and a half ago, we would have about 70 or so slots, and we'll be ramping up each year to those slots. So there are 3 entry points: fall of 2022, this fall, spring of 2023, and fall of 2023. And you'll hear more about this from your DEIB coordinators at the ed co-ops, and then, of course, from our staff here at the Kentucky Department of Education. If you have any questions for me, please feel free. If we have a couple now, I can answer those now, but please feel free to send me an email. And many of you have my personal mobile number, and I can put that in the chat. We want to make sure that we're being the best resource for you. Thanks, Tony. Do we have any questions, Tony? Any questions in the chat?
I need to go back over to the Google, but I think we're going to do those at the end there, Dr.
Okay.
Woods-Tucker.
Okay, sounds good. Mickey, please take it away for our Office of Teaching and Learning.
Thank you so much, Dr. Woods-Tucker. Well, good afternoon, superintendents. We'll not be taking much time today, but I did want to accelerate and bring to your attention 3 key resources that have recently been published in the Office of Teaching and Learning, 2 of which are connected to literacy. And I am joined today in the webcast by Christy Biggerstaff. So Christy has joined the KDE as the Office of Teaching and Learning Director of Early Literacy. So you will see her contact information come up twice today around some key initiatives that will be of particular interest to you. And I want to start with a discussion around early literacy screeners. So per Senate Bill 9, the Read to Succeed Act, the KDE was charged with compiling a list of approved universal screeners and diagnostics. So we've listed on the slide in front of you today just that web page. And so on that web page, it denotes our selection criteria. So we're very purposeful in looking at additional measures to determine what is valid, what is reliable as it relates to the screeners. We also have a comparison chart, and you may want to begin with just that at-a-glance comparison chart. It gives more of a high-level overview, and then you can really start to dig down into the one-pagers for those screeners that may be of particular interest to you. But any questions that you have related to the list of screeners, you can certainly email Christy or myself, and we will be sure to get back with you to provide support around that. I did want you to know we are hoping within the next month to also release a list of diagnostic assessments that would be denoted as being valid and reliable as well per the language of the bill. So that is soon to come. The next piece that I want to talk about is connected to the Kentucky Reading Academies. And so phase 1 of the letters registration closed as of August the 5th, so last Friday, and we are already notifying participants this week. So you would likely have administrators, teachers across your district who are receiving communications from the Kentucky Department of Education that they are joining us in the Kentucky Reading Academies and the Letters Professional Learning as part of phase 1. There will be a live virtual welcome celebration and letters kickoff on August the 23rd at 4:30 p.m. So that's just an hour meeting where we want to really just celebrate those teachers and administrators who are joining in the work. We have been very honest in that it is extensive professional learning, but we believe just to our bones that it's going to be beneficial to teachers and students across our state. So Christy will also be your contact for information regarding the Kentucky Reading Academies. And Christy, is there anything else you would like to mention today related to either the screeners or the letters training?
Hello, all. Yes, I'm so honored to be here with you today. I have a deep respect for superintendents in the Commonwealth as I am married to one. So we have 2,020 educators signed up for the letters in phase 1. It's so exciting. We did send out acceptance letters today with the information about the letters live kickoff meeting in August. So they should be receiving that. And since I have a captive audience, I would like to say something just very quickly. If you don't remember anything else that I say, I hope, superintendents, that you will remember this. We are losing the race with literacy in Kentucky, and this is a race that none of us want to lose. Several of our data sources say that half of our third graders cannot read at a proficient level. I don't think any of us would say that's okay. So I urge you to look at the Senate Bill 9 implementation guidance that you can find on the KDE website. Of course, the resources that we have shared with you here today. If you have teachers participating in the Kentucky Reading Academies, I ask you that you please support them by all means. It is a big commitment, as Mickey said, but it takes more than one professional learning session to teach our teachers how to teach our kids to read. If you have any of your K through 5 teachers that did not get enrolled for the phase 1, phase 2 is coming. It's going to open up the 1st of October, and we hope that you will join us then. I want you to encourage all of your teachers to participate if possible. And thank you for the important work that you do, and I hope you have the best school year yet.
Thank you, Christy. You all can see I feel very lucky to have her on board as part of the Office of Teaching and Learning team. And just as a side note to this, superintendents, if you have issues about shipping concerns related to the Eastern Kentucky flooding and other areas, we want to be responsive to that. We want to make sure that you get your materials. And so we have heard from some teachers who have concerns around that. And I've talked to Christy, and we're making sure that we can get Lexia the correct information so that those materials are received and can be utilized moving into phase 1. So thank you for that. And then we just have one more slide, and it's connected to the Reading and Writing Instructional Resource Consumer Guide. So this is found on the High Quality Instructional Resource webpage of KY Standards, and Crystal Rowland, who's the director of the Division of Program Standards, is the best contact regarding this particular resource. But it is created to assist you in the evaluation and selection of high quality instructional resources related specifically to reading and writing. We do plan to release future consumer guides. Mathematics is the next up on the list, but this one is specific to reading and writing. We felt that it was timely as it relates to Senate Bill 9 and many of the concerns connected to the essential components of reading. But within the guide, it does link you back to the curriculum development process that's established in the model curriculum framework. And so again, if you have any questions regarding any of these supports, we ask that you do reach out. We're happy to provide the help that you may need and answer any questions that you may have. So thank you so much.
Thanks, Mickey, and great update. And I think we've got Q&A now, but I've looked at the spreadsheet, and it doesn't seem like we have any new questions and answers that have come in. So I think we covered all the COVID ones and monkeypox ones early on. Those were the only questions that we received. So I think we can go ahead to our next meeting. So go ahead and put on your calendar, September 13th. We'll have another superintendent webcast for you. And with that, I think that concludes our webcast. Tony, anything that we've missed?
No, just a reminder again about the huddle for the flood impacted districts on Thursday, and then the webcast next month. Thank you much.
Okay. All right. Thanks, everybody. Have a great afternoon and a great opening of school.